on Healthy Living, we throw light on the ongoing fight against HIV/AIDS as the world marks World AIDS Day on December 1st. We hear a personal story of resilience from a young woman who lives openly with HIV and advocates for widespread HIV treatment. Plus, in Sierra Leone, authorities roll out an Ebola vaccination campaign for healthcare workers nearly a decade after the West Africa outbreak. That's in this edition of Healthy Living. Hello, I'm Linor Moudou. Welcome to another episode of Healthy Living. December 1st marks World AIDS Day worldwide with the theme, Take the Right Path, My Health, My Right. Experts are calling on the right to health and address the inequalities that hinder progress in ending AIDS. According to UNAIDS, 39 million people worldwide are living with HIV, and over 29 million are accessing life-saving antiretroviral therapy. However, 9.2 million people still lack access to treatment. Sub-Saharan Africa accounts for 65% of all global infections. In Zambia, the Total Control of the Epidemic project demonstrates the power of community engagement, focusing on prevention, treatment, and ending stigma. These efforts are critical as countries race to meet the UN goal of ending AIDS as a public health threat by 2030. Kati Short has more from Patoke, Zambia.
Lozi Zulu has been living with HIV/AIDS for 5 years. She's a beneficiary of a Humana People-to-People program, a project working with communities fighting against HIV/AIDS, malaria and tuberculosis. Zulu got pregnant after testing positive for HIV, but her son is HIV negative. For that, she credits medical interventions that help mothers take life-saving antiretroviral drugs or ARVs to prevent mother-to-child HIV transmission.
I have been living like this for 3 years, almost 4 years. So we go together with my husband to collect our medication. We take PrEP and ARVs together. So I'm very happy we are still together.
Zulu's husband, Joseph Banda, is HIV negative. He takes pre-exposure prophylaxis, PrEP, a medication that reduces infection from HIV, the virus causing AIDS. Zulu and Banda are what is known as a discordant couple, where one partner is HIV negative while the other is HIV positive.
My wife takes antiretroviral drugs to protect her from transmitting the HIV virus. She has to continue taking this medication for life.
Margaret Zulu is a field officer at the Development Aid from People to People in Zambia, or DAP, helping clients around the community to ensure that they are consistent in taking their medicines. She says field officers and community health workers visit people living with HIV who fell out of treatment to re-engage them and help them form small HIV treatment adherence support groups known as trios.
This program of TCE epidemic control has helped people to have knowledge about HIV, about prevention measures, what to do if we have tested negative, what step they can do, or how they can live positive life when we find the discordant couple.
Mwamba Chunda works as an HIV focal point person with the Ministry of Health at Petauke District Hospital, helping HIV-positive people adhere to their treatments.
We used to lose a lot of clients on treatment. You know, when you share someone on treatment, within a certain period of time, they are lost. But we're engaging the community.
The project involves traditional leaders like village headman Yoram Mwanza to raise awareness in communities about HIV/AIDS prevention and treatment programs run by DAP.
We started going door to door, telling those who didn't attend the meeting that DAP has got this very good program and we should benefit from it because What we are learning is prolonging our lives, a good life.
DAP Zambia is implementing the TCE project in Zambia. Elise Sorensen is its managing director.
We are still saying putting people first. And the slogan in the TCE program is that only the people themselves can eliminate themselves from the TB and HIV epidemics.
The UN's bottom-up approach, combined with high-quality health services in Zambia, aims to move toward the global goal of eliminating AIDS by 2030. Kathy Short, VOA Africa, Petauke, Zambia.
Doreen Moracha is a young activist living in Kenya. She began speaking out publicly about her HIV status in 2015, talking about stigma, the use of ARVs, self-acceptance when diagnosed with HIV, and how to prevent the infection among the community.
I can't say I lost friends because I live with HIV. My friends are very supportive, but my relationship has been tricky even before I came public and talked about my situation. In my social media like YouTube, I educate people and create awareness. A lot of us, we are aware that HIV exists, but it is the education that we don't have. So I use my YouTube account to educate people about where we are with medicines and where scientists are with research, new ARVs and things like that. On TikTok, I put short videos of a message or hope that I live with HIV like others and don't fall behind. But the end goal is to reduce stigma, especially self-stigma, because many people are struggling with self-stigma that comes from society. On Instagram, Facebook, and Twitter, I use short messages of hope so people can use their medicines, educate them about stigma, but I don't say it as a motivational speaker will say. I use a lot of jokes because it's my story and this is what I'm living with every day. People living with HIV are humans like us. There is no difference. Let's not look at people differently because they have HIV. We need to look at them as humans. And for the people living with HIV, don't look at yourself and think that this is the end of the road. In 2024, HIV is not a death sentence. Just take your medicine and you can continue living your life as normal. And you can do anything you want. You can travel, get married, have kids, and you can get the job you want. There is no limitations. Sometimes we think that living with HIV, we have limitations. But as somebody who has been living with HIV for more than 10 years, I can tell you, there is nothing you can do.
Dr. David Sando from the non-governmental organization MDH in Dar es Salaam focuses on HIV and AIDS issues working under PEPFAR in Tanzania. It tells us more about challenges and opportunity in the country in the fight against HIV/AIDS.
The current HIV prevalence among adults in Tanzania is 4.4%. Which means 4.4% of adults in Tanzania are living with HIV. That corresponds to around 1,500,000 adults. And what we're actually seeing in terms of trends, there are higher prevalence among women compared to men. So 5.6% of women are living with HIV/AIDS as compared to men, only 3%, because women biologically they're more likely to acquire infection from a man than a man, from a woman. We are working very close with the government of Tanzania, Ministry of Health, and also PRAJ to advance national response to HIV epidemic, committed to ending HIV as an epidemic by 2030, and by we do this through really expanding access to HIV testing, which is important for identification. So we provide HIV testing, to over millions of people in a year, and we've been able to identify on an annual basis over 10,000 people living with HIV/AIDS and linking them to care. We are also supporting HIV treatment to over 500,000, HIV positive individuals. We are providing voluntary medical care circumcisions to, a number of people, men. We're also supporting, expansion of PrEP, pre-exposure prophylaxis, which has been proven to reduce risk of HIV transmission among key and vulnerable populations. We call for collective action to sustain and accelerate HIV progress, emphasizing the importance of right-based approaches and community engagement. And together, we can work towards ending AIDS as a public health threat by 2030, leaving no one behind in our efforts to create an AIDS-free generation.
Authorities in Sierra Leone have launched an Ebola vaccination campaign targeting at least 5,000 health workers. Many health workers caught the Ebola virus during the outbreak that hit West Africa a decade ago. Victoria Amunga reports from Kenema, Sierra Leone.
The name of dozens of healthcare workers who died in the 2014 Ebola outbreak. The names are displayed outside a hospital in Kenema, one of the worst-hit cities during the 2-year outbreak that killed nearly 4,000 people in Sierra Leone. Mohamed Feika, a healthcare worker here, recalls how many of his co-workers died after contracting Ebola while caring for patients.
That greatly affected me, looking at some social activity as well. You as well, let me just ignore myself. Let me look at other people.
Now there's an Ebola vaccination campaign to protect healthcare workers like Feika. The Gavi Vaccine Alliance in June launched a preventive Ebola vaccination program to help contain the disease and protect critical healthcare and frontline workers in high-risk countries like Sierra Leone.
There was that kind of fear among healthcare workers, even among the entire population. So upon taking the vaccine, I now have the confidence that maybe when there is an outbreak, I will not be infected.
The single-dose vaccine is being provided to healthcare workers in countries that have had Ebola cases and those that border countries that have experienced Ebola outbreaks.
It's going to be 20,000 vaccines to start with, and we feel this is sufficient to cover the frontline workers I've just mentioned and protect those that are most vulnerable. And then, of course, we will be replenishing the stockpile so that we still have that 500,000 and then moving to other countries that are at risk of high risk of Ebola outbreaks.
The Ebola virus is spread through contact with the bodily fluids of an infected person. The average fatality rate for Ebola is about 60%, according to Gavi. Since Sierra Leone is considered a high-risk area, the government has set up a public health agency to enhance detection of the disease and prevent further outbreaks.
We know we are in an endemic zone. We know it's only the matter of when and not if that will be an outbreak. Every week we have a suspected case that we have to respond to. So a dedicated agency has been created to just look at that, preparedness and response.
As part of the campaign, community and religious leaders are encouraging the public to accept the shots. The Reverend Usman Fona is one such leader.
We use the pulpit. The mosques use the minbar. The churches use the pulpit on Sundays and on Fridays, at weekday meetings, also at naming ceremonies. When we go to name children, we'll let the congregation that are present to know the value of vaccination.
More than 11,000 people died during the Ebola outbreak in West Africa between 2014 and 2016, most of them in Sierra Leone, Liberia, and Guinea. Authorities hope the Ebola vaccination campaign will help avert such a disaster in the future. Victoria Amunga, VOA News, Kenema, Sierra Leone.
Thanks for watching Healthy Living. For the latest news and coverage, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linochmudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.